This is breaking news.
Mayor de Blasio has an update on the coronavirus pandemic in New York City. Let's go to that now.
Of this city, the ability of the people of this city to do extraordinary things. Now, we have so many challenges that this crisis has brought forward. But that same spirit of doing what others may see as impossible or very, very challenging, we New Yorkers take on challenges all the time and we overcome them. So I want to talk to you today about the challenge we're seeing, and it's been made so stark by the coronavirus. The challenge of disparity, the challenge of income inequality, it has come up so sharply in the course of these last few months, but it's something we've been grappling with for a long time. And this needs to be a moment when we resolve to make more fundamental changes. The coronavirus itself and the economic crisis that's come with it has hit so hard in communities of color. It's hit immigrants so hard. It's hit small businesses so hard. We have so much work to do to create something better and fairer. And that's what we're going to do. We are committed to a just and fair recovery. So today, in a moment, we're going to talk about a very important piece of that recovery, a very important piece of an effort to do things differently. And it is exciting because it has to do with a brand new approach to supporting businesses in the Black community and providing the support they need to really come back stronger than ever. So we're going to go over that in just a moment. But first, I need to give you an update about the situation in a couple of neighborhoods in Brooklyn. And this goes back to everything that we are doing with the Test and Trace Corps, everything we're doing when we identify a problem, how we address it rapidly. Another thing that New York City is doing on a level unlike any other city in America. We now have the capacity through Test and Trace when we see a problem to address it fast and with a lot of energy, a lot of personnel, a lot of impact. So last week, I alerted everyone to the situation in Sunset Park. I was out in Sunset Park, Brooklyn yesterday. It was Get Tested Tuesday. And I was out there with a lot of volunteers, some of whom you see here, reaching out to people, telling them how important it is to get tested. And this outreach effort has been going on for a while, but intensely over the last week. Now, what the health department saw in the last week or more was an uptick in the number of COVID-19 cases. The outreach effort meant to get ahead of that, to instantly ensure that more and more people got tested, that we found where there were specific problems and addressed them, obviously by making sure people safely separated and the situation was contained. The increased testing gave us more information, more data to work with, more contacts to follow up on. What we know so far, thank God, limited community spread and not a cluster situation in Sunset Park. And we'll talk more about that. I also want to mention a situation in Borough Park, Brooklyn, that we're focused on as well, because we've seen an uptick just in the last few days. And particularly a group of 16 cases that came out recently that we see as an early warning sign. Again, we want to be always acting out of an abundance of caution. And we saw this in the Sunset Park situation by assuming there might be a problem, getting in there fast with a lot of energy, a lot of personnel. It makes a lot of difference. So we're taking the same approach with Borough Park. Some of these 16 cases are linked to a recent wedding, a large wedding, in fact, in the community. So we are working immediately to galvanize community leaders to work with Test and Trace Corps. I had a good call last night with a group of community leaders from Borough Park. They certainly understand the urgency of the situation. We want to get the message out that people need to be tested, that people need to wear face coverings, that we need to avoid those large gatherings that can cause a bigger problem. We're also mobilizing a larger response, mass distribution to houses of worship, engaging community organizations, whatever it's going to take, helping people understand that if they do test positive, they can safely separate and get a lot of support to do it. And anyone who's concerned that if they test positive, what's going to happen next, we want them to know that there'll be a lot of support for them to get through what really is, in the end, a brief period of separation. And we're going to have community members and community organizations that are going to play a big part in that. So again, overall, New York City is doing so well, and you'll hear today's indicators. They're pretty extraordinary as an evidence of what all of you have achieved. But we've got to stay vigilant about the basics, the social distancing, the face coverings, obviously avoiding large gatherings. This is really important that we take seriously that reality, because that will help us stop the spread of this disease. Now I want you to get an update on all these kind of outreach efforts, because they're so crucial to our success. And I want you to hear from the Chief Equity Officer of Test and Trace. She was with me in Sunset Park, Brooklyn yesterday and did a great job engaging residents directly. I want to introduce to you again Annabelle Palma.
Thank you, Mr. Mayor. And I'm here to share that our massive efforts to connect to the Sunset Park community and to New Yorkers as a whole continues. We have knocked on over 9,000 doors, made live and robocalls. We've handed out PPE. We have handed out flyers, connected to community residents, and we will continue to do all in our power to deliver the resources necessary to the Sunset Park community to fight against COVID-19. We've extended our rapid testing, deployed our mobile units, had success getting people tested in Sunset Park, and this has proven to be great progress. Between our point of care and mobile testing, we have tested over 6,500 New Yorkers to date with this effort, and over 1,700 New Yorkers are from Sunset Park. We started to see that effort pay off. Most recent data shows the percentage in positivity in the 11220 zip code stands today at 4.2%. This means our efforts are working. We are finding positive cases, monitoring them, and asking them and helping them to safely separate. Together, we can prevent a second wave of COVID-19 in New York City. This administration has a strong and committed responsibility to keep New Yorkers safe, but we cannot do it without you. We need your help. Please get tested. We have come too far to go through what we went through in the beginning of this pandemic. We owe it to our loved ones. We owe it to our communities. We especially owe it to our first responders who were crucial in getting us through the most difficult times. And it seems that it was long ago that our hospitals were busting at the seams with patients coming in with COVID-19. And I'm not trying to sound any alarms. As you heard the mayor, we are doing great, but we need to continue to work together. It is up to us to make sure that we don't let our guards down. We need New Yorkers to continue to get tested. We cannot stress enough the importance of face covering, of wearing a mask. This will continue to save lives. We know it's hot out there, we know it's uncomfortable, but again, it is so necessary to make sure we keep ourselves, our loved ones, and our communities protected. COVID-19 is still real, and it's a real threat. We want to let Sunset Park know you've been doing a great job at coming to our sites, are getting tested, and we encourage you to continue to make sure to tell your loved ones, your neighbors, where our mobile sites are, where our testing sites are, and for them to continue to get tested. Le quiero dar las gracias a la comunidad de Sunset Park. Con los esfuerzos de ustedes hemos podido ver resultados positivos. Queremos seguir luchando contra el COVID-19 y sin ustedes no lo podemos hacer. Vamos a continuar a luchar para asegurarnos que nos mantenemos sanos y salvos y vamos a salir adelante. Thank you, Mr. Mayor.
Thank you so much, Annabelle. And what I saw with Annabelle directly and other members of the Test and Trace team was really intensely engaging people. And folks have a lot of questions. And it was really important for people to hear, hey, testing is quick, it's easy, it's free. There was a wonderful testing tent right there in the middle of the park itself, in the middle of Sunset Park. And a great team out there, right in the middle of the community where people normally go. They created a testing center there to make it easy for people, and we're going to be doing a lot more of that. So thank you to you and everyone at Test and Trace. Okay, I'm going to go back where I started. That, again, this is not just a healthcare crisis, it's an economic crisis. It's a disparity crisis. And we are dealing with challenges that we haven't seen literally since the Great Depression in this country or this city. But the disparities are now being talked about rightfully in the bluntest possible terms. And this fight against income inequality, this has been exactly what this administration has been focused on for the last 7 years. But when it comes to the black community, listen to this fact. It is a deeply troubling one. First of all, in this epidemic, black businesses twice as likely to close for good as white businesses. But you also have to think about the racial wealth gap at its foundation and listen to this fact. Here in a city that's has about 22% African American population, so about 22% of all New Yorkers are people of African descent, but only 2% of New York City businesses are owned by members of the black community. Something's wrong with that picture, to say the least. We need to do things differently, and our Department of Small Business Services is leading the way, and they've put together a roadmap to help advance black entrepreneurship in New York City. This is something that you don't just say, okay, the private sector is going to take care of this. No, public sector needs to get involved to do the most we can to help black businesses move forward, especially with the challenges going on now. So, Small Business Services launched Black Entrepreneurship NYC last year. The simplification of that phrase is BNYC. 1,500 black business owners and community leaders and academic leaders came together to put together a vision of what would actually work on the ground for community businesses. And the idea is to do something profound, to start to close the racial wealth gap. Now, what do? Well, we know there's 3 big areas of concern that came out of this process. Obviously, access to capital and trying to right the wrongs of the past where that capital was not available to black entrepreneurs. Marketing, helping businesses, smaller and bigger, to have more access to the digital marketplace and more connection to new sources of revenue like government contracts. That obviously connects to everything we've been doing with the MWBE program of the city, minority and women-owned businesses. And then mentoring, getting folks who have been successful and have great networks to share that success, share those networks with up-and-coming businesses. So the BNYC partners have come together with a number of leading New York City businesses to do this work. And I want to mention a few and thank them in the process. Ernst & Young will be providing free one-on-one consulting to businesses to work on their business plans. Goldman Sachs will be providing access to affordable financing. MasterCard will help business owners to set up virtual storefronts. Major firms committing to this effort in a tangible way. And very importantly, a new BNYC accelerator at the Brooklyn Navy Yard, a $3 million effort to provide the space and the support and the know-how to help these businesses to move forward rapidly in one location where all that help is there to energize the efforts of entrepreneurs. I want to thank so many people who have worked hard on this, everyone at Small Business Services, Commissioner Janelle Doris and his team. Also, the folks in the City Council who were devoted to this mission, Speaker Corey Johnson, Councilmember Steve Levin, and especially Councilmember Lori Cumbo. She proudly represents the Brooklyn Navy Yard. She has been one of the strongest voices in the council for the empowerment of black businesses and for the support that the city needs to provide to help black businesses move forward. And she joins us here today. Councilmember Cumbo. Are you there? I can't hear you. Maybe on mute. Well, she hopefully will be joining us here today in a moment. Let's see if we've got.
Good morning.
There we go. Technology's working.
Can you hear me?
Yep.
Good morning, Mayor de Blasio, and so good to see you, as well as my colleague and friend, Annabelle Palmer. It's so wonderful to see you all, and I just want to thank you for your efforts with COVID and really the stamina that you have put forward to make sure that we get through this safely. So I thank you for that. This is really a very important issue that has been impacting our community. As we know, today, this month, is National Black Business Month. And so we know as a result of COVID, 80% of MWBEs that shared revenue information lost a median of $38,000 between the month of March and May 2020. 35% of MWBEs have not been able to operate during COVID-19, and 30% of MWBEs reported that they will only be able to operate for 1 month or less. and 85% of MWBEs reported that they will not be able to operate for more than 6 months. So we understand the challenges, but when we look at New York City has one of the largest populations of Black people outside of Africa and Brazil. We are the metropolis of Black people, of the diaspora, and it's critical that in answering the call to the Black Lives Matter, the Black Lives Matter movement was so critical in terms of recognizing the importance of our lives, but also of our dreams, our aspirations, our mind, our vision, our ideas. It's important that we become a major part. If we are, as people of color, almost 60% of New York City's population, it's critical that the business that the city does improves and matches with the level of diversity that is reflective of the city of New York. So I am super excited about this. The Navy Yard is an incredible partner, one of the greatest job producers in New York City, and will continue to be so. But Brooklyn, New York, and New York City specifically, needs to be a pathway and a gateway for Black-owned business to be designed, flourish, and to grow all across the city of New York. So I am proud that it's in my district. I'm proud that it's in Brooklyn. I'm proud that this is going to be for Black people and people of the African diaspora. This is going to be a critical opportunity for us to be a major part of the growth and the development of the city of New York. Thank you so much, Mayor de Blasio. I want to thank Janelle Doris for all of his work, and I want to thank everyone at the Navy Yard for their incredible leadership in making this possible, as well as Speaker Corey Johnson and Councilmember Steve Levin, my partners, and putting this together, and the capital resources of investment that's going to change the city of New York. Thank you.
Thank you so much, Councilmember. Thank you for your extraordinarily energetic efforts. As always, I've known you a long time, and you bring energy to everything you do. And thank you for helping to secure the funding for the great work going on at the Navy Yard. Everyone, this report is going to be a tremendously important roadmap for how we move forward. And this dovetails perfectly with the bigger work being done inside this administration by the Task Force on Racial Inclusion and Equity, literally bringing together all the agencies of the city government, led by people of color in the city government, to make real changes now, to redistribute right now resources towards the communities that have been hardest hit. This work is crucial, and it's going to keep building. Now, you've heard the vision from the government side. I think it's really important, obviously, to hear what this means to an entrepreneur. And one of the folks who's going to be creating those new jobs, who's going to be building those businesses up further and further. And remember, the investments we make mean that communities start to thrive more and more. People get jobs within the community. More and more people get opportunity. More and more people then can create their own businesses and employ more people from the community. That is the vision. One of the folks who's been on the leading edge of this, a member of the BNYC Cabinet of Advisors, and she is a founder of a venture capital firm that supports women of color with the excellent name Rockstar. She'll tell you all about it. A pleasure to introduce Gayla Jennings-O'Byrne. Gayla.
Thank you, Mr. Mayor, and thank you, Commissioner Doris, for allowing me to be part of the BNYC Cabinet. After a 20-year career on Wall Street and technology, I left Wall Street because I saw that investing in women was smart, profitable business. We are women who invest in women. My investment fund, Rockstar Fund, invests in the rock stars of technology, women of color, and diverse, inclusive teams. Each day we are training, coaching, and building with amazing companies that are innovating for the new normal that we all will be living in. How we work, how we live, how we dwell, how we educate, and how we innovate healthcare. But for too long, investors and institutions like banks and pension funds that invest the hard-earned savings of frontline workers have ignored women's startups and Black funds like ours. Our community is building products and services that help teachers, that help the police force and other frontline workers. Yet at the same time, they're being blocked from investing in their own well-being. We're filling that void, and we're stepping in where traditional sources of finance and support have shut us out. We help women of color grow their businesses and be successful. And we hope others will act differently and join us in their success. like this administration. COVID's had a huge impact on me and my business community, but imagine the impact business can have on New York City. This initiative will help us rebuild and unlock the potential of thousands of Black business owners. You have given a voice and literally a seat at the table to Black business. The solutions and the path forward are in the Black community. And a side note, I'm a witness to that when the lockdown happened, New York did not lock down. Days after we were all called to stay home, the folks at SBS approved our certification to be an MWBE business. It's clear that the access to capital and the resources can't be left solely in the hands of Wall Street or Silicon Valley. Only 1% of capital is getting to my community, yet 30% better profits and outcomes. Something's wrong. The public sector can be a great partner. I've seen it firsthand, the innovative partnership of this administration. The Rockstar Fund was chosen by New York City's Economic Development Corp to be part of a $30 million We Venture program. A major city and a new Black investment fund teaming up to co-invest in the city startup community? Groundbreaking. And now you're launching initiatives to support Black businesses. Once again, you are leading a new form of public-private partnership that all cities should adopt. So on behalf of my company, my team, and the BNYC community and cabinet, congratulations, Mayor and Commissioner Doris. Thank you for being an ally.
Thank you so much. Well, Gayla, first of all, congratulations on everything you have created and taking all of your skills and talents and experience and doing something that will really bring so many other people into economic opportunity. But I want to dwell, you could hear the passion in Gayla's voice. You could hear how urgent it is to right this wrong and get capital available for businesses that have so much to offer but have been shut out. So I think it's wonderful that the public sector will be playing a bigger role, and I think it creates some healthy competition. If our colleagues in the private sector want to reaffirm their commitment to equality, they can put their money where their mouth is. And some companies are stepping up, and we appreciate that. But right now, we're going to prove the public sector is going to help spark this kind of investment, this kind of fairness. And I welcome the private sector to live in the same spirit and really help businesses of color, particularly women of color businesses, move forward. We've got the roadmap for you. All you got to do is come and join the effort. So thank you again, Gayla, for all you've done. Thank you to everyone in this effort. And now I'm going to do something we do every day, but it's not going to be like every day, because not only do we have the new indicators we talked about yesterday, but you're going to see something that is striking in terms of indicator number 3. But let me go over them in order. First of all, daily, number 1, daily number of people admitted to New York City hospitals for suspected COVID-19, threshold 200. Today's report, 64 patients. But again, we're now telling you the number that have actually been confirmed positive for COVID the most recent day of testing. That number is just 8.7%. That is very good. Now, number 2, the new second indicator, new reported cases on a 7-day average basis. Threshold of 550 cases. Today's report, 320. Number 3, percentage of people testing positive citywide for COVID-19. Again, we have moved the threshold now from 15% to 5% as we continue to tighten up. We continue to fight back this disease. We now told you we're doing everything down to the decimal point so you can see more specifically what's happening with the testing. The number I'm showing you here today is the lowest number we have had since this crisis began. This is the lowest infection rate in New York City since the beginning of the coronavirus crisis. Today's number, 0.24%. This is extraordinary. Now, we all know every day can vary. We all know there's no single perfect measure. But the fact that with expanded testing and more outreach all the time, you now see a number as low as 0.24% for the New York City infection rate. This is striking, and this should be a clarion call to all of us to double down and go farther, because the more we can do to beat back this virus, the more we can bring back this city. So congratulations to all of you, because this is your achievement. A few words in Spanish. Hace unas semanas notamos un pequeño aumento en el número de casos de coronavirus en Sunset Park, Brooklyn. Con esfuerzos comunitarios pudimos llegar a más personas en el área para que se hicieran la prueba de coronavirus y parar la propagación. Los neoyorquinos no podemos bajar la guardia. Necesitamos seguir cuidando nuestras comunidades usando mascarillas y manteniendo la distancia social. With that, we turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're joined today by Small Business Services Commissioner Janelle Doris, Chief Equity Officer of the Test and Trace Corps, Annabelle Palma, and Senior Advisor, Dr. Jay Varma. The first question today goes to Erin from Politico.
Hi there, Mr. Mayor. A couple of questions. First of all, could you tell us a little more, and maybe the health experts a little more, about the situation in Borough Park? I heard you mention 16 cases, but is there an overall number of cases, a number of tests, positive rate that's gone up? And there's been a theory out there that that neighborhood might have some herd immunity. So does this kind of knock that down?
I'll start as the layman, and I'll turn to Dr. Varma. Look, again, I met with community leaders last night to talk about this. First of all, it's a great question, Aaron. I don't think we have any evidence of herd immunity anywhere in New York City. I think that is, we're nowhere near that point from what we know. And I understand that's something that's gotten around out there and sort of folk wisdom in many communities, but I want to note that we don't have proof of that. And we should just work out of abundance of caution, not rest on that laurel, if you will. Second, the number of cases we've seen, an uptick that's noticeable, and there is a nexus to one particular event that we're looking at carefully and doing the disease detective work on through test and trace. That's what's causing the particular concern, an event that was larger than it should have been, and one that we're following up on right now. And hopefully we'll find there was not a substantial spread, but this is why we do the test and trace work, to get ahead of something like this. Dr. Varma. We can't hear you.
Thank you for the
question.
There you go. So I think it's important to understand that there's a difference between sort of immunity and what people are, what was commonly referred to as herd immunity. Immunity means that if you've been infected, you might be protected from infection, either partially or completely, for some time, a few months, a few years. We're learning more, and the latest information from CDC is that most people who have an infection are protected in some way for up to 3 months after that initial infection. The problem is we don't know how much protection people have after that, and whether that means they're fully protected or not. So I think, what we're seeing in the situation in these neighborhoods where we see higher infection rates is that, everybody should still consider themselves potentially at risk of infection. It's just safest to plan that way. If we learn and discover in the future that people with a prior infection are fully protected for a lifetime, that would be wonderful. But we really need to plan around what we consider to be the most credible, scenario right now, which is that people who have been recently infected are probably very likely protected for up to 3 months. But anything beyond that time, we just simply don't know.
Yeah, but Jay, speak to the larger question of herd immunity in the context of New York City or any of our neighborhoods, because I know we've all talked about this quite a bit. Could you sort of give the definitive answer on whether herd immunity could exist in New York City right now?
Yeah, so this concept of herd immunity is that once you reach a certain level of immunity across the entire population, that you may get individual isolated infections, but you won't get outbreaks. Because if I get sick and I cough on somebody else, or I cough on 3 people, if 2 out of 3 of them are immune, then this infection just won't continue to spread anymore. What we have from our antibody surveys is that somewhere between 25 to 30% of New Yorkers, broadly across the entire population of New Yorkers, have demonstrated some prior infection with this virus. You know, they have an antibody test that indicates that almost certainly they were infected at some point. That is not a level of antibody coverage that we currently think would mean people are fully protected. There's a lot of discussion going on about, well, is the antibody testing that will indicate protection? Are there other measures that you need to use? But from our perspective, the only way to continue to keep infections low, like we have right now, is to focus on all the things we're doing. Face coverings, social distancing, limits on gatherings, good hygiene. And it may very well be that there is some percentage of the population that is currently immune that's also helping keep our infection rates low. But I don't think we should be complacent and rest upon that until we know more.
Go ahead, Aaron.
Okay, and then a different topic. There's another member of your administration, Catherine Garcia, potentially getting into the race for mayor. Just wonder what you would think of her as a candidate.
So Catherine spoke to me some months ago and said it's something she might consider. To the best of my understanding, she has not made a final decision. I mean, look, she's been an outstanding commissioner, obviously, and done great work, not only at sanitation, but on addressing the food crisis now and the issues around eradicating lead poisoning in the city. So I really appreciate the great work she's done. Again, do not know if it's something she is going to move forward with, but all I know is it's something she's considering, and she's a very worthy person. Go ahead.
The next is Gloria from New York One.
Hi, Mr. Mayor. I wanted to ask you first a question on the 9/11 tribute memorial sort of back and forth that we have been seeing in the last couple of days. I don't believe you have spoken about it. So I guess first I just wanted to get you to weigh in on what's been going on here now that we know the ceremony is back on. Did you know that we're going to cancel? And now that there's a second memorial that's going to happen, you know, why haven't you been involved, it seems, in this process?
Yeah, Gloria, first of all, that whole process of decision is not something that's involved City Hall at all. Literally, no one from the 9/11 memorial reached out to me. No one consulted with us. They went and did what they did. And I know their intentions were good. They were trying to address this crisis and really focus on health and an abundance of caution. I think what they did was a mistake initially, because it's such an important moment for the families who lost loved ones, for so many people who want to remember on that day. And the notion of keeping people safe is obviously crucial, but I think what would have been smarter is what they've ultimately decided to do, which is basically keep the same ceremony, keep the same very moving tribute in light, just make a few health modifications and distancing modifications like we do with so many other things. So to me, I think it's now been resolved more sensibly. But no, I want to be clear. Some people thought that I had something to do with it, my office had something to do with it. We were not consulted in the least. If we had been, I would have told them, stick to the original plan, but you know, let's do some health and safety modifications.
In regards to the announcement that you are making today, the Black-owned business plan, I just want to clarify, was this the specific plan you said was released previously? So it sounded to me like at the end there you were sort of calling out to these bigger businesses to come in and get involved, sort of challenging them to step up. But what are you doing to make sure that they come in, since it sounds to me like this is a plan or a report that the city had put together before the crisis?
Yeah, and to say the least, and I think Gayla would agree with me, the crisis in terms of Black-owned businesses, the crisis existed long before the coronavirus. That figure that I shared with you, 22% of all New Yorkers are African American and only 2% of businesses are owned by Black people. Something is profoundly wrong there, and it has to do with 400 years of injustice, obviously. But we've got to fundamentally change the rules of the game, and that is not going to happen within the private sector, although the private sector can and should do a lot more. It's going to happen with government intervention to start to right the wrongs. This was a really smart effort to engage with entrepreneurs and to engage with private sector partners who want to be part of the solution. It was started back in the fall to address, again, an ongoing crisis of generations. But the real issue here is I am challenging the business community. A lot of people are expressing real concern as a result of the Black Lives movement, and I admire that they're expressing the concern, but I'd be much more appreciative if they would change that concern into investment. Take the words and turn them into deeds and invest in Black-owned businesses. Let me see if Commissioner Doris wants to add.
Yes, certainly. Thank you, Mr. Mayor. I think part of what you said is absolutely right. In this new era where we are now, the city cannot do it by itself. The private sector cannot do it by itself. We've got to come together and really work on one of our core principles around collaboration. And so, yes, Goldman Sachs, MasterCard, Ernst & Young, and other partners out there, we are working with them to make sure that this need and this gap is actually filled. So we do agree, certainly, with calling on all of the private sector. We do that in the report and say that we've got to do things differently. We cannot allow Black businesses to fail at twice as much as white businesses. We cannot allow them to walk into places where they can get financial support and be declined more than any other group. I think this is the opportunity. This is the moment for us to do more for our Black businesses and make sure that they have the opportunity that everyone else has. And that's what this report does. That's what this initiative is about.
The next is Aaron Cooper from CNN.
Hi, thank you very much. I just wanted to ask about people moving out of New York City permanently. We've talked to some that have left and some others that are considering it or thinking about it. Do you have any estimate on how many people the city could lose, and how bad is this going to hurt? And then additionally, some of the people we've talked to have been blaming your administration for making the quality of life worse, including increasing crime or homelessness. How do you respond to those kind of concerns?
Sure, Aaron, look, first of all, this is something, this whole crisis has now played out over 6 months. It is way too soon to know what the long-term impact will be. It's understandable that some people who had the means to do so went elsewhere. The vast majority of New Yorkers were here, and the vast majority of New Yorkers are going to remain here. And now, Aaron, we are one of the safest places in the whole country when it comes to the coronavirus. As you heard today, 0.24% infection level. We got a lot of work to do to keep it that way, but I think everyone with eyes to see can see how strongly New York City has come back in terms of healthcare. And you can see that the economy is starting to come back, but we have a long way to go. The things that make New York City great are going to continue to attract people here and keep people here. There's no question. So we do not have a specific estimate because I think it would be a fool's errand to try and estimate now something that you can't really understand until we see the bigger play out of how we address this disease ultimately with a vaccine and how we bring the economy back, what kind of stimulus we have, what happens in the election in 76 days. All these factors, I think, will determine. To the other point, I think it's just politics, honestly. As recently as February, Aaron, we had the most jobs in the history of New York City, 4.6 million jobs. We had driven down crime to levels that we had not seen since the 1950s. Our school system was showing greater success than it ever had in its history. That was February this year, and those were the policies of my administration. What we got hit with was an absolute perfect storm, a healthcare crisis, an economic crisis, a budget crisis, a social justice crisis, a crime uptick, all at once, and all interrelated. But this too shall pass. And when it does, the strength of New York City will come to the fore again. Go ahead.
Thank you.
Aaron, do you have a second question?
No, I'm great. Thank you very much.
Thank you.
Go ahead.
The next is Katie from the Wall Street Journal.
Oh, hi, good morning, Mayor de Blasio. I wanted to go back to the small cluster you're noticing in Borough Park. You mentioned that some of the...
Sorry, Katie, just to be very careful, my apologies. The term cluster is a really a weighted one. We're seeing, again, some cases, we're seeing more cases, but we certainly do not want to call it a cluster yet. We don't have that evidence.
My apologies, the uptick or the 16 cases, and you mentioned that some of those 16 cases can be traced to a large wedding in the community. My understanding is that large weddings are not allowed. I know we saw this at the beginning of the pandemic where there were still, in certain communities in the city, funerals and other large gatherings. So will there be disciplinary action? Is there an investigation into this large wedding to see whose it was? And will there be, any kind of action against that large wedding, which I was under the impression is not allowed?
It's not allowed. You're absolutely right. The rule now is that, and I think I'm up to date on this, that gatherings can be in a gathering hall, catering hall, for example, up to 50% capacity, but no more than 50 people. And from what we're hearing, this was certainly substantially more than that. That's just not allowed. We're going to figure out what to do to address the situation retrospectively, but I'm really honestly much more concerned about the going forward right now. We've got to identify the folks who are at that wedding and follow up to make sure if there was any spread, it's contained. And that's why we do test and trace. It's as simple as if someone might be infected, get them tested. If they are, safely separate them, make sure it doesn't spread any further. You do that fast enough, effectively enough, you really contain the spread. So that's the goal here. But we are doubling down starting today through the health department with catering halls to let them know that those standards must be kept. We'll certainly be doing inspections. We're working with community leaders who I think have been extraordinary allies in this whole effort of trying to keep people safe. Dr. Dave Choksi was on the call I did last night with community leaders. He's going to direct the health department to do the follow-up with these catering halls, and I believe that that follow-up will be felt very clearly. Go ahead.
And my second question has to do with small businesses. I know this initiative discussed this morning focuses on a particular subsect of small businesses, but when I speak to small business owners, they're really struggling, and it has to do with the real financial issues. So I've asked this before, but with the commissioner on, the Small Business Services Commissioner, what can be done for businesses that need help financially, paying rent, paying insurance? Today it's pouring rain, there's a thunderstorm. Restaurants are not going to make any money today beyond takeout, so that's a big hit to them. So if you could outline a little bit for all business owners, those who are still struggling to stay afloat in the city, what is being done, particularly on the financial end?
Yeah, and I'll start and I'll pass to Commissioner Doris. Look, it's a very, very fair question, but I also think New Yorkers, especially small business owners, appreciate real and blunt answers. So here's the truth. The federal government made meaningful effort to help small business. I don't think it was necessarily structured ideally. I don't think a lot of smaller businesses of color benefited as much as they should have, but at least there was a meaningful effort in previous stimulus. There should have been and still needs to be a much bigger effort to help small business in a new stimulus that should be happening honestly right now. And that should be everything from rental assistance for small businesses to a variety of other direct support to keep them going. That is where the money is. The state is in great fiscal distress. The city's in great fiscal distress. We're not going to be able to do a major financial effort. It's just the truth. What we can do and have been trying to do is find any way we can to facilitate businesses opening up, providing them PPEs, providing them any opportunity to get going again, and providing direct legal help dealing with landlords. There's a variety of specific, obviously we did some grants and loans early on, but that money has been exhausted. But I want to emphasize, as I turn to Commissioner, any small business that's struggling should be speaking with Small Business Services, because in a number of cases they've been able to find solutions to help businesses tide over. And the last thing I'll say before the Commissioners, I think this is the point again, Katie. If the stimulus efforts keep failing now, we could easily be in a situation where there's a very, very different reality in Washington in a few months, and then I think a very different and bigger kind of stimulus. And that certainly could be an opportunity to help small business on a much bigger scale. Go ahead, Commissioner.
Thanks so much, Mr. Mayor. You're absolutely right. This situation is in need of a federal response, and certainly what the federal government was able to provide with the PPP loan program also did not hit communities really that are targeted and hurt even more so by the COVID crisis. As it pertains to small business services, we're here to help all small businesses. We've been doing it throughout the crisis. 30,000 plus calls to our hotline. where we assist those businesses in finding financial assistance and support. We've already connected over 4,000 businesses to over $78 million in support for their businesses, and we will continue to do so. We have 40 lenders that we work with as well to assist our small businesses during this time. Look, if you're a small business out there and you're struggling, our hotline is 888-SBS4NYC. 30,000 businesses we've already assisted on that hotline. We will continue to assist them, and we want to make sure that you have what you need. But we have to say it again. The crisis is in need of a federal stimulus. We need federal support. Small businesses in this city cannot make it without the federal government stepping in on the financial side and helping them. And we'll do all we can, but as the mayor said, we need the federal government to step up.
The next is Dana from the New York Times.
Hi, Mr. Mayor.
Hey, Dana, how are you?
The city had a story yesterday about the size of the First Lady's staff and how 6 of her staffers are listed on the books of other agencies. Can you speak to the propriety of that?
Sure. I think that article didn't take into account the work that's being done. So this work is about the needs of the people of this city, especially in this crisis. What the First Lady's focus on now, mental health as always, but the mental health crisis is now much deeper because of the coronavirus across the whole city, particularly in communities of color, particularly for children. And it's very, very important that we provide a lot of support to young people as we go into the new school year. So that's one of the things that she's been working on intensely, but also as the co-chair of the internal task force, this extraordinary task force of leaders of color within this administration, the Task Force on Racial Inclusion and Equity, that has been moving big policy changes literally with the purpose of redistributing resources to communities that are most affected, 27 neighborhoods most deeply affected. That work spans almost every city agency. So people are working with her constantly who are parts of other agencies because the work involves agencies all through the city government. Go ahead.
Thank you. And secondarily, as far as the potential for 22,000 layoffs, have you determined whether those potential layoffs will in any way impact your or the First Lady's staff?
Oh, unquestionably. There will be layoffs at City Hall. There's no question about it. For my staff, her staff, everyone. There's going to be layoffs. There's going to be a huge fiscal impact on every agency of the city government. And again, our job is to work together to try and avert it, because the last thing we want to do in the middle of an economic crisis is lay off a bunch of people and not provide as much service. And you think about all of our agencies, what that would mean for the city, how it would set us back. So, I don't have a lot of hope right now for a stimulus. We'll keep fighting for one before the point that layoffs would happen. Maybe, there'll be a surprise here, a good surprise from Washington. But I think the more likely possibilities to avert layoffs are to focus on long-term borrowing in Albany, where I think there's more and more recognition that long-term borrowing is a necessary solution. And obviously working with labor to find savings, and a lot of our labor partners are working with us intensely on that.
The next is Shant from the Daily News.
Yeah, good morning, everyone. I was wondering if you and Dr. Varma could clarify the use of the term cluster. For what it's worth, while during the conversation this morning, I did Google coronavirus cluster definition, and one of the first things that comes up is a paper on the CDC website that says we define a cluster as greater than or equal to 5 cases. So I don't know if this definition, if there's a universal definition, if it's case by case. Can you just speak to that, please?
Sure. It's a great question, Sean. I'll start as the layman, and Dr. Varma will be your expert. I just want to say at the beginning that one of the things I've noticed throughout the coronavirus crisis, and I think Dr. Varma will affirm this, we've talked about it many times, is there's not the kind of ideal, consistent national, international definitions here that we would like in many ways, because people, the medical community, the scientific community still doesn't fully understand the coronavirus, and there's very different interpretations in different places. But I want to say here, just on a common sense level, a cluster is when we have a bigger and more sustained problem. Remember, testing is such a valuable, crucial part of the equation, but it's always somewhat arbitrary because it depends on who got tested on any given day. And that's not ubiquitous. That's not, we don't have a situation, as you've seen in a few places, where there's been near universal testing. There is a certain arbitrariness. What we look for is, do we see a sustained problem? And particularly, do we see a problem that relates to a specific source that is a bigger problem? Not, a few cases, but something more bigger and more sustained. And that, thank God, so far is not what we're seeing in the case of Sunset Park. What we're seeing in the case of Sunset Park to date is more isolated to individual households, where the spread was just within the household, not in the larger community. So that's my preface. Now, Dr. Varma, you can give a more erudite answer.
Yeah, I think the answer is that different groups and different public health agencies use these terms differently. I think, as the mayor has noted, really what we try to use the term cluster when we're referring both to a specific number of cases that we think is concerning, combined with a link to some specific event or exposure that they have in common. So what we're seeing in, for example, in Sunset Park, and what we've been seeing, for example, in Borough Park, is an increase in the number of cases above what we would expect, but we can't link it right now to a single common exposure.
Go ahead, John.
Got it. Switching gears a bit to baseball. Al Sharpton is calling for the Mets to be sold to J-Lo and A-Rod, saying the sale represents a significant opportunity for Major League Baseball to take a strong public stand in favor of racial equity. Would you join Reverend Al on that call?
Yeah, I would, actually. And I'll tell you something. Sean, you know something about my baseball history. So I don't come into this as someone instantly connected to A-Rod, to say the least, but I respect him. I mean, he's one of the greatest players of all time, obviously. I think it's true that all of our sports, including Major League Baseball, have to do a better job encouraging ownership by people of color, leadership positions for people of color, more people of color managers. This is a profound problem in baseball and in all American sports. I think the way you change that is one team at a time.